I'm joined by Erica Boom, and we're here at a beautiful center here in Southwest 8th Street in Miami, and this is Belly and Kicks. You can obviously see around you the exercise equipment, and Erica's been doing this for a long time, and she's a professional at what she does, and she trains women specifically to have a better birth. Erica, thank you for joining me today.
No, thank you for having me here.
How long have you been doing this?
About 7 years already.
Okay, and here at Belly and Kicks, what happens on a typical day? Pregnant women come in. Do you only work with pregnant women?
Yes, I only work with pregnant women one-on-one. In a typical week, let's put it that way, a girl comes in twice a week, in average. Every time they come in here, they spend 40 minutes with me. I do a full body workout with all the machines that you see here, all the free weights. We do a lot of stretching and a lot of prenatal specific work.
When you say prenatal specific work, what does that entail? What do you mean by that?
I focus a lot on the core and the lower back. First, they need a strong lower back to support the growing belly. Two, I familiarize them with the transverse muscle, which is like the muscle that's basically gonna hold the belly and it's gonna push the baby out during the pushing phase of labor. And I help them to familiarize with the pelvic muscle as well, the pelvic floor, getting familiar with all those three muscles.
Now, a question just came up to mind. I know that because of the hormones, there's a lot of shifting of bone in the spinal cord. Do you know if the exercises that you do helps for that?
The exercise, I do focus a lot on the belly of the muscle, which you're gonna get it stronger, and ideally it's gonna release some of the stress that the bones suffer throughout pregnancy.
Okay.
So the idea is that if the bone stretches or the alignment fails somehow, you have a strong muscle to continue like carrying you throughout the rest of the pregnancy.
So throughout the years that you're doing this, do you hear of less backaches because women are doing personal training?
Oh yeah. They come in here with terrible back pain, weak back, stretch abdominal muscles. I put them here on the program. We emphasize a lot their lower back, and the back pain is gone by a couple of weeks.
That's beautiful. That's great to hear. So if you have any lower back pains, go to a personal trainer, obviously somebody that's certified. Do you have to be certified? Do you take a special class just to work with pregnant women?
Yes, you should.
Okay.
There's a lot of contraindications to exercising during pregnancy, and the trainer should be very familiar with that.
Okay, so if I can ask you, and of course, I will mention again, just like I mentioned with Mia and yoga, any type of medical advice or anything that sounds like medical advice is not to be taken as medical advice on this video. Please go to your healthcare practitioner. Erica, what type of contraindications are we talking about?
First of all, there's certain moves that should be prevented, like anything that you're lying on your belly or actually lying on your back after the first trimester should be avoided. That would be one thing. The other one would be maybe deep squatting or deep lunging if you have like an incompetent cervix or if you're carrying multiples. Doctors sometimes don't want you to be deep squatting because of that. Three would be you want to always emphasize that they breathe through the stickiest part of the movement, so don't hold their breath, because that will bring your blood pressure up, and it's not good when you're pregnant.
Okay.
So you have to look a lot at the face of your client and remind them, breathe, remember to breathe and keep breathing. They need to hydrate properly. And just overall, there's certain exercises that become uncomfortable with the growing belly, so you accommodate them.
So you basically customize. Do you have to customize for each individual woman? It's not just a set workout.
Yes, each person's different. For one girl, has a pain in their pelvic bone, the other one in the back. Their round ligaments are hurting. Their breast doesn't let them like push down, deep enough. So each person's different.
So then the woman has to be very well aware to tell, and the personal trainer has to be very well aware of what's going on with her, we can call her client or patient almost, and she has to be well aware of what to tell the woman that she's working with or the person that she's working with, otherwise there could be serious injury.
Exactly.
So it leads me to my next question. When should a woman begin personal training before her pregnancy, during her pregnancy? When's the best time to begin?
Ideally before pregnancy. That way your body got used to the stress of exercise. You arrive into pregnancy in a fitter state, but that's not the case for a majority of women.
I would imagine.
So I would say if you've been already working out, you can continue. You can start right away. A lot of the women are conservative if it's their first kid during the first trimester, and they like to take it easy sort of to see how things develop. And then they pick it up around 13, 14 weeks. And then for second-time moms, they already have a history, they know how everything goes. So I have a lot of second-time moms coming in by the 5th, 6th week because they already know.
Now let's say a woman never exercised before,
Mm-hmm.
and she would like to get pregnant. She's thinking of getting pregnant.
Mm-hmm.
How many months before she actually says, okay, I'm going to try with my husband now to start getting pregnant? How long before do you think is good to start something like this?
To start working out?
Yes.
At least 3 months. 3 months is more or less the period the body takes to adapt to any exercise program. So that way by the end of at least 3 months I would say.
Okay, and my next question, what if a woman is already later on in her pregnancy?
Mm-hmm.
When should a woman absolutely not come and do personal training?
Okay, the latest I receive people in the studio is 32 weeks, no later than that. If they come 34, I tell them come after you have the baby. It's already too soon, for your due date. So
what could potentially happen for a woman that says, either with a personal trainer or just says, well, I just want to start working out by herself? What could potentially happen to her?
At this point, all your ligaments are stretched out, the muscles are weak enough, you can injure yourself, you can add additional stress to your body that you don't need at that point, basically.
Okay. Yeah, so, please always keep in mind if you're later on in your pregnancy, if you're in the 2nd or 3rd trimester, if you've been listening obviously to Erica, what she has said, if it's too late in your pregnancy, please do not start working out. Erica, is there anything else that you'd like to tell women out there as far as personal training or pregnancy is concerned?
I would encourage every pregnant woman to exercise while they're pregnant. It's gonna make a difference in the way they feel, in the way they look. It's gonna help you with your energy levels. It's gonna help you to feel better. And it's going to help you to cope with all the discomforts, the physical and emotional discomforts that pregnancy brings.
Thank you very much, Erica, for being with me today.
You're welcome.
And it's been Erica Boom Center, which is Belly and Kicks, and there she is, hard at work, busy at work.